Hi students, today we will see about the antenatal care. The antenatal care is just a systematic supervision. That means both examination and advice. It is because it is the examination and advice is in the bracket. Don't forget to write it during the examination. It is a systemic supervision of that include examination and advice of a woman during pregnancy. It includes careful history taking and examination that both general and obstetric examinations, advice given to the pregnant woman. The aims of antenatal care include to screen the high-risk cases, prevent or to treat the complication at the earliest, to ensure continued medical surveillance and prophylaxis, to educate the mother about physiology and anatomy of pregnancy and labor by demonstration and charts, to discuss the couple about the place, time and type of delivery, and to motivate the couple about the need of family planning. Monitor the fetal growth during pregnancy. The objective of antenatal examination is to ensure a normal pregnancy with delivery of a healthy baby from the healthy mother. There are some terms that means gestational age. It is the age in weeks and days calculated from the last menstrual period. Developmental age or conception age or otherwise known as embryonic age. It is the number of weeks and days since fertilization. Definition of hospitals. Level 1. It is a community or rural hospital that provides maternity care for a woman with no major risk factors and normally without specialist support. Level 2. A community or a regional hospital that provides care of a low and high risk pregnancies with specialist support. Level 3. A tertiary hospital that provides care for low and high-risk pregnancies with perinatal, neonatal and anesthetic service available on the site. Level 1 hospital, that means we have already seen it, available for labor and delivery room in approximately 30 minutes and must be prepared to respond promptly to a request from the hospital personnel. Gestation means the state of being pregnant. Embryo, conceptus up to 10th week of gestation. Fetus, human conceptus from 10th week until delivery. Viability, it is the capacity of living. That means capacity of living outside the uterus. That is, most commonly it is after 22 weeks. Gravida, the woman who is pregnant regardless of the outcome. Nulli gravida, the woman who has never been pregnant. Primigravida, pregnant for the first time. Multigravida, pregnant for more than once. Para means it refers to past pregnancies reached the period of viability. LCB means last childbirth. Nullipara means the woman who have never completed the pregnancy to the period of viability. GPLA means gestational age, para, living birth and abortion. Primi means the first pregnancy. Parturient is the woman who is in labor. Procedure at the first visit. Vital statistics include name, date of the examination. Age is important because if 30 years of age or above are called elderly primi. The same way the patient is below 18 years, it also carries the risk factors. Duration of marriage. Whether they have any treatment for fertilization, means infertility treatment, religion, occupation of the mother and the father, means mother and the father. Mother because if it is having any complications on the baby, father is to note the economic status of the patient. Occupation of the husband, period of gestation in terms of completed weeks, any complaint the patient is having, history of present pregnancy, obstetric history past and present, menstrual history, past medical history, past surgical history, family history, personal history. Physical examination include height. Height, it is Indian standard we consider as a 150 as the lowest level. If it is 150 or below, it may be the patient may be having CPD, cephalic pelvic posture, because the mother will have a small pelvis to accommodate the fetus. Weight, vital signs especially blood pressure, nutrition of the mother, pallor, jaundice, tongue and teeth, gums, tonsils, dental hygiene, neck for any lymph node enlargement, breast for any retracted nipple, lymph node enlargement on the axilla, edema of the legs. Edema of the legs because of physiological or pathological. Physiological, we have seen in the other classes. Pathological, it is maybe because of preeclampsia, anemia and hypoproteinemia, cardiac failure, renal disease, and nephrotic syndrome, varicose vein, thrombophlebitis of the leg veins. Obstetrical examination include abdominal and vaginal. Routine investigations for the blood, HB, ABO, RH incompatible, RH grouping, blood sugar, VDRL, hepatitis B, HIV, urine for protein, sugar and pus, USG. Proceed subsequent visit. The frequency of the antenatal checkup up to 4 weeks. 4 weeks means once in 4 weeks up to 28 weeks. Once in 2 weeks interval up to 36 weeks. Weekly till expected date of delivery. Objectives of the continuing antenatal examination is to assess the fetal well-being, to check the live presentation, position and number of fetuses, anemia, preeclampsia, amniotic fluid and fetal growth of the mother, to organize specialist antenatal care for patients with problems like cardiac problems and diabetics, to select the time for USG amniocentesis or chorion villus sampling if indicated. History, to note any new complaints, date of quickening. Examination include general examination is each visit, then weight, pallor, edema of the legs and blood pressure in each visit. Abdominal examination. The aim of abdominal examination include to observe the signs of pregnancy, to assess the fetal size and growth, diagnose the location of fetal parts, detect any deviation from the normal. Methods of abdominal examination is inspection. In inspection, we have to check for size of the uterus, shape of the uterus, contour of the abdominal wall, skin, umbilicus, condition of the bladder and fetal movements. In palpation, estimating the period of gestation, that is by placing the hand below the sternum, by moving gently down, see how many fingers can comfortably accommodate between sternum and the fundus, or measure the distance between fundus to the symphysis pubis in terms. From 18 to 32 weeks, symphysis of fundal height in centimeter, same as gestational weeks, that is known as the McDonald's rule. Abdominal girth in inches. Fundal palpation is the first Leopold done facing the patient's face. Whole fundal area palpated using both hands to find out which pole of the fetus is at fundus. The broad, soft, irregular mass is stiff of the breech, but smooth, hard, round mass is stiff of the head. Lateral palpation or second Leopold done to find out the position of back, limbs and anterior shoulder. Smooth, curved, resistant mass, fetal spine, the small knob-like mass with space between sensitive of the fetal limbs, well-marked prominence in the lower part of the uterus above the head. Pelvic palpation. First pelvic grip is known as fourth Leopold, done facing the patient's feet if the head is presenting to note the precise presenting area, attitude and engagement. Presenting part is cephalic prominence, palpated and its relation to the back. Attitude, relative position of the sinciput and occipital poles, engagement, convergence and divergence of the fingers. Polygrip or second pelvic grip or third Leopold, done facing the patient's face. If not engaged, mobility from side to side is tested. Auscultation, the fetal heart rate has to be ausculted for 1 complete minute. Findings include size of the uterus, live presentation, position, engagement and fetal heart rate. This is the first Leopold, it's the second Leopold, it's the third Leopold, the polygrip, and the fourth Leopold is the first pelvic palpation. Lie is the relationship between long axis of the fetus and long axis of the uterus. There is longitudinal lie, oblique or transverse lie. Attitude is the relationship of the fetal head and limbs to the trunks. Presentation refers to the part of the fetus which lies at the pelvic brim or in the lower pole of the uterus. Normally, vertex constitute nearly 96.8%, breech 2.5%, shoulder 0.4%, face 0.2%, brow 0.1%. Denominator is the name. Denominator word meaning give a name. It is the name of the part of the presentation which used when referring to fetal position. In vertex it is the occiput, in breech it is the sacrum, in face it is the mentum. Position is the relationship between denominator of the presentation and 6 points on the pelvic brim. Engagement is said to have when the widest diameter presenting transverse diameter has passed the pelvic brim. Positions in vertex position means left occiput anterior, right occiput anterior, left occiput posterior, right occiput posterior, direct occiput anterior, direct occiput posterior. Antenatal advices. The principles of antenatal advice include to impress about importance of regular checkup, to maintain or improve the health status, to improve and tone the physiology, psychology and remove the fear of unknown. First one including diet, maintenance of maternal health, needs of growing fetus, strength and vitality required during mother, supplemental nutrition therapy, antenatal hygiene regarding rest and sleep, bowel, bathing, clothing, smoking and alcohol should be avoided. Drugs without the doctor's prescription should be avoided. Constipation it's a common minor element of the first during the pregnancy because of the pelvic low means the peristaltic low means less peristaltic movement. It can be improved by taking fiber containing diet. Jerky traveling should be avoided. Ongoing antenatal care include fetal movement pattern has been changed, whether it is poor weight gain or weight loss, proteinuria, glycosuria, basiluria, BP systolic above 155 or diastolic above 90 mm of mercury, uterus small or large for date, excess or decreased liquor, malpresentation, head is not engaged in primary woman after 38 week of gestation, any vaginal bleeding, any premature labor, any vaginal infection. All these risk factors has to be assessed on the ongoing dental care, because means if any dental problem it has to be corrected or checked before becoming pregnant. Care of the breast, retracted nipple has to be checked. If it is there, we have to correct it by gently pulling it out by applying means during the bath by applying some little oil and gently pull out the nipple. Coitus should be avoided in the first 3 months. Air travel contraindicated in PH placenta previa and severe anemia. Smoking and alcohol should be avoided. Immunization, normally 2 doses of TT. Tetanus toxoid injection has been given with 1 month interval time. Then antenatal exercise they have to practice transverse exercise, pelvic tilting and rocking, pelvic floor exercise can be practiced during the antenatal period. It will be helps in the easier early recovery of the postnatal period. Then purpose of ongoing antenatal care include to continue to observe the maternal health and freedom from infection, to assess the fetal well-being, to ascertain the fetus has adopted a lie-in presentation that will allow vaginal delivery, to offer opportunity to express any fears or worries. Values of antenatal care: to screen the high-risk cases, detection of high-risk factors, regular supervision of pregnancy, acceptance of advice. Signs of previous childbirth include the breast becomes small, flabby, nipples are prominent if the breastfed, primary areolar pigmentation still remains and also white stria. Abdominal wall is more lax and loose, presence of white stria will be there. Uterine wall is less rigid and contour of uterus is broad and soft rather than the ovoid. Perineum lax and evidence of old scarring from the perineal lacerations or episiotomy can be visible. Vagina is small, spacious and introitus is the gapping will be the minor disorders of pregnancy. We can see it by trimester wise. In the first trimester, breast changes, urgency and frequency of maturation, malaise and fatigue, nausea and vomiting, thylism, gingival hypertrophy and nasal stiffness and epistaxis, leukorrhea, psychological dynamics of mood changes. Second trimester, it is pigmentation, supine hypotension syndrome, food cravings, heartburn, constipations, varicose veins, headache, back pain. Third trimester, shortness of breath, insomnia, leg cramps, ankle edema. These are the common minor disorders during the pregnancy. Screening and assessing the high risk pregnancy is the one in which the life or health of the mother or the fetus is jeopardized by an incident which is coincidental or unique to the pregnancy. Health problems. Three major problems have pre-existed for last 50 years: hypertensive disorders, infection, and hemorrhage. Three leading causes of mortality are gestational hypertension, pulmonary embolism, and hemorrhage. Perinatal problems are congenital anomalies, preterm and low birth weight babies, infant death, respiratory distress syndrome, and effect of the maternal complications. Thank you for listening. If you have any comment, please let me know.